My name is Dirk Laubscher. I've been a physiotherapist for over 11 years. I'm the owner of a health clinic in Harley Street in London called Videojug Limited. And today I'm going to give you guys some tips and advice about neck pain and associated conditions. How to relieve neck pain and dizziness. Now firstly, if you have dizziness, we have to find out why you're dizzy. Now there can be quite a few reasons for that. A very common cause of dizziness is that you have a problem in your mid-ear. If that is the case, then we can do, as physiotherapists, we can do vestibular exercises to help you with that. Other causes of dizziness could be head injuries. Sports guys come in and, for example, rugby players who had a head injury or collision on the field, or car crash. Anything that where there's trauma involved can cause concussion, which can cause pressure on the brain, that can cause dizziness. Usually with these patients they have accompanying neck pain as well. So whenever a patient comes in who had a trauma or some type of head injury and they have dizziness and neck pain together, it's very important as a physiotherapist to assess very well. Because what you get is you get the skull, and the skull rests basically on the first vertebrae, okay, which rests on the second one. And this is a very important area, just because you get all the nerve structures and the spinal column coming through there. Now if you have a little fracture in one of these or a ligament tear and you have an instability, which means that that you have more movement in the segment than you should, to try and manipulate or treat the neck in those cases can be detrimental and very dangerous. Now if you've assessed that and the neck seems to be fine and stable, then we can treat that. Again, neck pain, and dizziness with head injuries, you'll have trauma in the neck, you'll have stiff joints, muscle spasm, which we treat successfully. Another very important thing with dizziness, which we can't overlook, is it's called VBI. It means that if you look at these red structures here, all right, these are the arteries that supply your brain with blood. Okay, now if they are compromised in any way, usually on turning the head, the opposite side will tighten up, and it's like a straw, and you're pushing the straw closed, which means that there's not a lot of blood, or you're actually cutting off the blood to the brain, which will result in immediate dizziness. Again, that's a condition that has to be reinvestigated by specialists, and a contraindication for us as physiotherapists to manipulate the neck. Okay, so when it gets to neck pain and dizziness, it's a bit more complicated than just normal neck pain. And these aspects, the stability of the first vertebrae and the arteries, has to be reinvestigated and assessed before we treat it. So after assessment, and we've assessed that this area is stable, that there's nothing moving that shouldn't, and the arteries that supply the brain with blood are in good shape, then we can successfully treat neck pain and the dizziness through mobilization, strengthening, and vestibular exercises. And that's how to relieve neck pain and dizziness.